All right, welcome back, everybody. We're going to talk about flu season. Once again, joined by Dr. Ben Roney, primary care physician from Adventist Health Castle. First of all, thank you very much for coming on in.
Thanks for bringing me back.
Yeah, well, we're going to keep doing it every month until we're all healthy. We don't need to hear from any doctors anymore. So that ain't going to happen. You know, this kind of reminds me about hurricane season. We tell people, okay, pack your hurricane kit. We talk about it. Same thing with flu shots. People hear it. Does it frustrate you when people don't act on it?
Yes and no. On the one hand, I don't want to make people feel like they, you know, if it's late in the season, like, oh, I don't want to go see my doctor because he's going to scold me for not getting my shot. But on the other hand, you really should get it.
All right, I want to go down the list. Well, first of all, why is it important that one gets his or her flu shot?
So every year it's a little bit different as far as what strain is causing the most trouble. If you look back over the past 10, 20 years, some years you're looking at, within America, maybe 10,000 people die, some nearly 50,000. But not everyone can get the shot. Little kids under 6 months of age can't get the shot. Some people with weakened immune systems don't get it. And even some people who get the shot still can manage to get the flu, especially older patients.
Okay, so let's talk about some of the questions people have. Some are more myth than a reality. Can you get the flu from getting the shot? Some people say, oh, I got it one time, I got sick, I'm never getting a flu shot again. Can you get sick from getting a flu shot?
So you can't get the flu from getting a flu shot, but you can still feel kind of junk. Your body can react. It's having an immune response, and you will have, or you can have the muscle aches, the chills, things like that. But sometimes people get sick from other reasons, right? It only works maybe 2-3 weeks after you get the shot. And even then, as I said, it's not 100%. And so a lot of people, they'll get a cold, right? They'll have a runny nose.
And they blame it on the shot.
Yeah. But at the same time, if you have fevers, chills, muscle aches, things like that, come in, we can swab your nose and actually let you know if it is the flu or not.
Okay, that's my next question. People get sick, they don't know, was it just a cold, was I feeling junk, or did I have the flu? It's important to know.
Yeah, we have antiviral medications for the flu if we catch it early. If you come in 4 days later and you have had all these symptoms, it's, you know, a little bit too late at that point. But if you come in early, we can do something about it. And
Tamiflu.
Correct.
Right.
And if it's not the flu, then we can let you know that it wasn't the flu shot that gave it to you.
Okay, if you find out you did have the flu and it's early in the season, say right now, should you still get vaccinated going forward because there's still many, many months ahead?
Yeah, once you actually have the flu shot, the effect of it declines a little bit over the next 6 months or so. And even then, you still have multiple strains of flu, and the shot only covers 3 or 4 different ones. And so I would say you should probably still get the flu shot because you might have gotten one strain, you still have all these others that you could get throughout the rest of the year.
Okay, what should you do if you get the flu?
So it sort of depends on if you have any other health issues. I mean, people who have asthma, things tend to get worse. I would say if you feel like you were hit by a truck, you know, you have a fever, you feel absolutely terrible, the sooner you get in, the better, because if you have those other issues, we can kind of protect against that. And if you are able to get in the first 24 to 40 hours, we have things like Tamiflu that we can give you.
Right. Okay, 2 more questions. The first is, who should not get the flu shot? You already mentioned young children, pregnant women, elderly.
Well, the flu shot we use this year is not the live version, so you can't get sick from it. There are some people who have allergic reactions to it. If you have, you know, difficulty breathing, something more than hives, you shouldn't be getting the flu shot. And if you really need to, let's say you have an infant at home, you should do it at the hospital where we can give you medication for it. Otherwise, pregnant women should definitely get the flu shot. The elderly should definitely get the flu shot.
Okay, and then my favorite one, when you have that coworker, okay, I'm not saying that Bridget falls into this category, I never get sick, I'm not going to get no flu shot. That's ridiculous. I'm the bull here, I don't have to worry about it. You're basically jeopardizing everybody else around you.
Yeah, I mean, Bridget is very healthy, and she probably would do fine, probably. But you still have thousands of people that die every year from the flu. Some of them are young, and it's surprising. But the more important thing is you need to build up herd immunity. Everyone needs to be vaccinated and immune against the flu so that the people who don't get the shot, say young infants who can't develop those antibodies yet, they're protected.
Right. And if you feel like you've been hit by a truck, you got stuff leaking out of different places in your body, don't come to work.
Yeah, come to the doctor's office.
Yeah, great. You get to deal with that.
Yeah.
Doc, appreciate it. As always, Dr. Roney from
Thanks for having me.
Castle Adventist. Thanks for coming.